everyone, welcome back to the Dr. Alex Show. And today we're going to talk about some trends in health, trends in healthcare. This is going to be good because we're going to hit trends on the medical side as well as more of the holistic, and well, I guess the holistic side, if you will, where I like to live. And I think it's going to be a two-parter. And this has come up because of some questions. So whether it's questions in office that Dr. Lauren and I are getting, or questions that have come in on social media pages and even emailing in after hearing some things on the show, people just want to know more. And then I'm thinking with some of the topics, I actually need to dive into getting more information out there because it'd be really good. A really good example of that is we'll talk about the vagus nerve. I think we'll talk about that one today, and we'll talk about vagus nerve stimulators, and people are really kind of trending on that nowadays. So I think it'd be most appropriate to start with red light beds, red light lasers. Of course, I got one of our 4 shed light cold lasers on me right now. And when it comes to our lasers, let me explain that our shed light cold lasers from Dr. Griswold, shedlightcoldlasers.com, these guys are the most versatile tool that you can use for either yourself in office as a professional or even home. I like these because these are devices that anyone can buy. Yes, they are a chunk of change, but it is something that you can utilize for so many different issues. Going over what this thing does, when we turn this on, we're going to shine, you can see red light, bright red light, going into my hand. And this laser has red light and infrared light. Now, red light, obviously we see. If you know anything about the spectrum of light, we don't see infrared. So the red that you're seeing on my hand, if you're watching this, is a guide light. It's just showing me where that light's entering my hand. Now, red light is, you can say, more hydrophilic, means it likes water. It likes things that are more water-like in the body. Like it likes blood, it likes fluids, it attracts, it gets attracted to fluids in the body. And therefore, with our lasers particularly, when light is shined onto your body with it, this will get into the body depending on where you're shining. That light will get in there by up to about 2 inches. For instance, if I put it on my brain, if I shine it on my head, it might be getting in here maybe an inch or so, give or take. On, let's say, a baby's brain, where that skull's not as thick, it's not as hard, and there's just less tissue, it'll get in there quite a bit further, probably double the distance. Now, what's cool about red light is it travels in the fluids. So the units of light, photons, turn into electrons or run into electrons, and that's what's called photobiomodulation. So turning into electrons, running to electrons, what you have to know after that is it helps speed up healing. It helps make the mitochondria happy, and when the mitochondria are happy within your cells, then we kickstart metabolism and the cell starts to do activities like turning over oxygen and getting waste and inflammation out. And when we shine particularly with our shed light cold lasers, shine that red light onto the body, if we get it, let's say, down on the tummy on the aorta, those photons are going to enter the aorta, and then you bet they're going to travel all over the bloodstream. And now we're getting global effects. If we put it on other big blood vessels, absolutely. Sometimes just keeping it on the wrist here is great because it's going to get into that vasculature quickly and pretty efficiently, and then it's going to travel all over the body. Now, the other light here, infrared, is not as hydrophilic, more hydrophobic. It likes to hang out with things that are more fatty based, so it stays within the tissues. And what's really cool is particularly with the majority of the work that we do with our lasers, red light is inflammatory, good inflammatory for helping make new neurons and new neuronal connections. for the brain. Red light or infrared is anti-inflammatory. So it's going to be utilized in different fashions depending on the goal that we're trying to achieve in office. But between red light and infrared light, and then the fact that you can put this thing anywhere other than directly over your eyeball for the most part, this can get used on so many applications. Just the other day, a boy comes in after tripping and falling down a hill on his, I believe it's called a ripcord, the skateboard that you have to balance and one side can go one way, the other goes the other way. Anyway, awesome spatial awareness and balance and coordination for him, but he ate it going down a sidewalk and tumbled down a hill. Really scarred up his face, a lot of swelling, and immediately put the lasers on him to start bringing the swelling down so we can, in the next couple of weeks, get an assessment of brain function after his concussion because he did black out. Already making changes. Put the lasers on my son Kuiper this morning. He's got bug bites just covered all over the place. He woke up just itching like crazy. What's really cool is one thing that I did is I put the laser on him, stopped the itching, swelling went down right away. So the redness around the bug bites was already becoming pale. That was awesome. Then, fun trick for most bug bites, take baking soda and use that as your cleaning medium. So put that on your washcloth or whatever it is you're using and make it into a good paste. So we ran that on him to neutralize any of the acids from the bug bites. That brought it down even more, made him feel pretty good, and then ran the lights on it again before he left for school, and he's just back to being him goofy self. It's all good. So we'll do that again later today, and these bug bites will be almost gone. Really good example of how you can just use it for, again, just about anything. So that's lasers. Lasers come in all shapes, sizes, and colors, actually. Different colors have different wavelengths. They do different things. With clinical-based lasers like this, what's going to happen is the light is going to converge, and it's going to enter the body and get in there deeper to get a greater effect on the tissue, the organ, the part of the body that you're trying to heal up. Like these lasers here, this is really good, for instance, for helping out with bone breaks. We've helped our son and our neighbors and other people that have broken bones, and we'll put it on there for quite some time, and it will A, help with the pain, but B, speed up healing. Every single person, when they go into the orthopedic surgeon, whether they need surgery or not, every single person that we put our lasers on for broken bones, they've healed up faster, and the surgeon is like, what did you do? And they're like, we put a laser on, and they're like, oh, okay, well, that's great. I guess it worked. So have fun, go home, just be careful. It's kind of like what they say. So for the other colors, I really can't speak to that because the only other color that we have is ultraviolet. We use that for infections, so we can use that for topical and more systemic-based infections. I didn't bring that laser in today, but that's an awesome laser, again, for infections. Other colors, your blue, your purple, and even green, different wavelengths for different purposes. You have to look that up. Now, that brings up beds, red light beds, red light panels, red light wraps, red light helmets, red light masks, red light foot socks, red light gloves, just red light everything. They are out there. They are all over the place. They are great. The thing is let's go over a couple basics. Maybe be careful about this stuff on Amazon because when it comes to some of these panels, the manufacturers, a lot of them come from China. No offense to China, but what happens is they produced for the longest time panels for actually veterinarian purposes. And then they're like, hey, so this is pretty cool. We're making some money. Why don't we sling this towards people? And that's one contributor as to how these panels started getting into the market space. So like anything else from Amazon or discount websites, et cetera, you want to be checking for a couple things. One of them is, I kind of hate to say it, check for the FDA label. It doesn't mean that it's an FDA-approved device for treating something. Like, for instance, our lasers are FDA-approved non-specific. It means that they're FDA-approved in terms of what this device is exactly what it says. The FDA has inspected it and said, yeah, this thing is fully capable of any claims that can get put behind of it, and the inner workings of it are exactly what it says it is. And non-specific is cool on our part because it means we can use it for anything. If this were an FDA-approved laser for pain, it means I could only use it for pain. And then if I go and use my lasers on something other than pain and hurt someone, then I'm in trouble. So if it's FDA approved or FDA inspected, I don't know the technical nomenclature. It means that it's gone across their desk and it's going to be a device that is capable of what it says it is. If it's something you're getting on Amazon that hasn't been breathed on by the FDA or even some private third-party reputable organization that inspects said devices, then I would stay away. And it's not going to be worth your pennies unless there's something out there that just has a great reputation and it does a great job and it doesn't meet those other criteria. So I can't speak to certain brands. I can't speak to anything like that. The biggest difference is with the beds, the panels, the sleeves, the masks, the helmets, all that good stuff. The light is what's called divergent, so it's going to diverge off of, or diverge away from the panel, not converge together. So it's not going to go as deep, not nearly as deep as at all. Nothing wrong with that per se, but you're not going to get the potential systemic effects that a laser like this could potentially do for you. The other thing is what they are good for is skin conditions, some anti-aging, clearing up acne, wound healing, just like these are great for wound healing. Having a red light panel is great for wound healing, and they are good for some pain. But again, it's not going to be as robust of an effect because arguably this laser here can go halfway through your knee. Those panels are not going to go halfway through your knee. But you are going to fill it up with a bunch of photons and get some good anti-inflammatory, antioxidative effects. And it's certainly not a bad thing. Now, if you have a panel of any kind and you're using it and it works for you, you got your answer. This is where I say it doesn't matter if it's placebo or not, because with any of this stuff, if it's placebo or not, as long as it works for you, that's all that matters. Because the only reason the placebo is there is because of good brain function. So if you think that this light panel works for you, and let's just say in all reality, all the studies show it does nothing for you, it's nothing but a pure placebo effect. There's nothing to be had from a healing effect at all. Doesn't matter, because your brain says, yep, this is helping me, and then that means your frontal lobes are firing and it's starting to regulate that bodily process more efficiently, especially with something like pain. So if it works, let it rip. If it doesn't, then maybe it means it's just not the right modality for what it is you're trying to help yourself with. So that's panels and light and everything else. I can't say I haven't been in a red light panel or anything like that. I don't think we're going to get one because in a lot of suburban areas and bigger cities and things like that, there's just franchises that are opening up with nothing but red light panels, red light beds. Even some tanning salons, franchises, they're starting to have red light beds. It would actually be really good for sunburn because this thing is awesome for sunburns. If I ever get sunburn or my family, we just laser it away and it's gone in a half a day or the day after. It's pretty incredible. Also, red light panel beds are opening up in things like massage therapy based clinics, kind of like our friend Angel Reno. She came on the show and she's talking about how she works at a local Massage Heights here in the Kansas City area in Leawood. So if you want a good massage, go to Leawood for Massage Heights. And they're getting ready to take those franchises and slowly turn them into more multi-service options, like having maybe some red light beds. So they're popping up all over the place. So go ahead and give it a whirl if you'd like. like anything else in the more holistic side of the coin here is you have to give it time. It's usually not a one and done thing. So got to give it multiple rounds. That brings up another thing that's getting thrown out there a lot. And this was used a ton in the world of physical therapy. I know I had my share growing up, but it's getting to be very trendy and you can do it on your own. And that's cold plunges. So cold plunges are popping up because you can get your own little ice bath. You can get your own portable bath. I have a good friend and neighbor that has basically a collapsible bath, fills it with water, goes and gets ice, dives in for I think he does about 10 minutes. You can get more permanent setups. The sky's the limit on how much you want to pay. And this is good because it is very anti-inflammatory. It is fantastic for brain health in terms of the cold. Same thing for cold showers, but you're going to get more bodily effects from the ice from an anti-inflammatory, globally speaking standpoint with these cold plunges. Now, the problem that's popping up with some of the cold plunges is people are doing it too often. It's happening too much. And there's actually a couple patients of ours that we have actively seeing us where they are doing cold plunges anywhere from 2 to 3 times a week, sometimes more. These are people that train a lot. They do a lot of physical activity. I'm talking well over an hour of pretty robust physical activity a day between any sort of aerobic and anaerobic based exercises, all your CrossFitters, things like that. And what's going on is these people are starting to break down with their overall resilience and their stress adaptation, and they are having some mental health issues because of it. And not because of the cold plunge, but because what's going on is they're putting their body into stressful situations way too often. And the cold plunge is just one of those. So let me emphasize that. So imagine you have someone who is your typical suburban mom or dad, but they train pretty heavily throughout the day. They might be a small business owner. They might have some sort of highly respected, high responsible job. They have their kids that run around and do 18 things like the rest of us. And now they're doing all of this extra stuff for their health, but they're doing maybe too much of some things. And it's just too much, and it's straws that are breaking the camel's back. So what happened with these individuals is kind of just that. It was too much. And then the cold plunges were stressing their body out too much. And now they're having hypothalamal-based problems with stress adaptation. So this means they're not adapting to temperatures as well. They're definitely not pumping out appropriate amounts of cortisol. It's actually kind of waxing and waning with a couple of these people, where it's actually very high at some points, maybe for a day or two, and then it tanks just completely in the pits. And this is looked at on adrenal salivary index tests. So it's really, all of this is really putting their body into a bit of a tizzy, if you will. And this is a bit of a side rant, but anyway, cold plunges, even just like red light beds, they're awesome, but there is too much of a good thing. So I think a good overall safe number for most people would be once a week, based on what I see with other patients, people that use them, and also from the tiny bit of research I looked at comes from the world of athletic training, or athletic trainers and personal trainers, people that are on sports teams that are routinely using these for the anti-inflammatory effects for aches, pains, and sports recovery. It's like once to twice a week. But again, that's coming after certain types of training sessions, not even like after, just a random practice. It's like, no, we're going to do it after this day because we're working on, let's say, power and pure explosion-based drills creates a lot of soreness. There's a lot of lactic acid buildup after these types of exercises. And it'd be good to go do a cold plunge or an ice bath after that. So like everything else, keep it to a good conservative number to start. Do your research on what you feel comfortable with. Talk to someone that's educated in this stuff. And it is kind of like a trend, but it's awesome. It's a great little modality for everyone that you can do, and you don't have to have your own bath or anything like that. You can just use a tub at home and turn that puppy on as cold as you can get, and go get a bunch of ice, or get as much ice out of your freezer that you can, and see how you feel. And it's about maybe 10 minutes is about max, is what I would do with that. And personally, that's about all I can take. So, but now I suppose the next trend or next thing that's popping up a lot is anything in the anti-aging world. But I think we'll save that for next episode, because with anti-aging, that comes supplements like collagen-based supplements. That comes with even going to like places like medical spas. So I think one more little thing that we'll talk about is going to be actually semaglutides. So semaglutides, those GLP-1 agonist drugs, they are all the rage. People are using them for not only their type 2 diabetes and just massive obesity problems, but people that just want to trim that extra 20 pounds, 15 pounds, 10 pounds that is just being stubborn. So what do these drugs do? Semaglutides, GLP-1 agonists, it means that these drugs act on these receptors called GLP-1 receptors. And when they get on there, it's going to do a few things. It's going to raise your insulin, which is going to help keep your blood sugar down. It's going to slow down your stomach from emptying. And then overall, it's going to take other functions like what's called glucagon, which is a hormone that releases when you need to bring your blood sugar up. If it's getting low, it's going to take that and be like, nah, you can go away. We don't need you. So it's going to take place of this natural hormone in your body to do this. And the kicker is it's really hard on the pancreas. And like a lot of other drugs, it can come with some serious things to consider. And then there's the other problem of maybe you have to be on them the rest of your life to maintain that weight loss. So talking about GLP-1s, even this week I had this conversation, I think 3 or 4 times 3 times. 2 times it was, what do you think of them? And basically what I say is, well, it's a drug like anything else. So first and foremost, this thing comes with what's called a black box warning, and it says this can cause and has been tied to thyroid-based cancers and medullary types of cancers. That's kind of a big deal, because cancer is already serious, and it can already be very detrimental to your health, your family's health, and everything. It can just take over people's lives, obviously. But those types of cancers, when you're talking about a very anabolic organ, it can cause a lot of health. It can cause a lot of problems, and quite frankly, be a mess for you and God knows what else. So drugs that have these black box warnings, they're all over the place. They come in just all shapes, sizes, and types. For instance, some antidepressants come with black box labels of causing more depression. As goofy as that sounds, here's a drug that's supposed to help with depression, but it's going to cause depression. Or this drug is used to help with keeping you more alert and have better focus, but it could cause depression. Or this is a drug for your pancreas function for something else, but it's been tied to this autoimmune disease. They're all over the place. And some of them are risks that people are just like, yeah, it's fine. And then some are not. When it comes to GLP-1s, it's coming more and more that if you start using them, you're probably going to have to be on them. I think there's going to be problems in the future for these people between possibly cancer, but then pancreatitis. And pancreatitis is something to not shake a stick at either, because that's either coming from using and abusing it for decades on end and developing diabetes, or just drinking yourself into oblivion for decades, or you can have some sort of congenital-based pancreatitis problem. But that can get nasty. And then you can have liver issues. You can have abdominal stoppage or GI tract stoppage from it. Just no more working. Gastroparesis doesn't work. Your GI tract no longer pushes fecal matter out. So it's not to, I guess, be, I don't know, pessimistic, or you can obviously see my bias. It's just, I think that it's like a lot of drugs that when they hit the market, we end up finding out 5, 10, maybe 15 years down the road that it wasn't good. A really good example of that is, no offense to anyone taking them, but statins. Statins are tied to neurodegeneration, Alzheimer's, forms of dementia, you name it. Because if you're blocking the very pathway that's needed to produce certain fatty substances that your brain needs, and your brain's nothing but fat and protein, well, you're going to have brain issues. So another good example would be like proton pump inhibitors, antacids. They're tied to absorption of B12. No B12 means that you're going to have more brain problems. And the list goes on. So with that last conversation with someone in office, it came from a gentleman who is quite a bit more round than he is tall. He's up there in his years. His health is rapidly declining. He knows that there's things that we have to offer, but I think they're kind of at this realistic point of, does it make sense for them to spend money on things that we have to offer to slow down degeneration of any kind and maybe gain some functionality? Or do we stabilize as much as possible and go into our sunset years and enjoy what we can with grandkids, family, etc.? So that's a tough conversation. But he did bring up semaglutides. He goes, what do you think? And I was like, well, what do you think? And he goes, well, he basically cited off everything I just said. You got to worry about the black box warning. We don't know the long-term side effects. We're probably going to find out nasty things about the long-term side effects. Probably got to be on them for a long time. And what I do want to state is I think a lot of people take more than they should. So I want to bring that up. That could be not necessarily like a benefit of the doubt or anything. It's just I think people are taking more than they should is going to be a problem. I know that some branded drugs are getting tied to more nasty situations than others. So that all comes down to doing your homework. It's all available, people. But he goes, well, what about my situation where, knocking off, lopping off like 70 pounds, what that could do for me? And he's not a candidate for any of the sleeve surgeries or anything like that. And he's just there's too many other health issues that are risky for the surgeons there. And I said, well, has your doc mentioned that? And he goes, yeah, it's an option. So we've thought about it. We just want to see what you think. And I was like, well, and his name's Bob, just first name Bob. I go, Bob, it's honestly, I have to admit, it's not a bad option for you. Because he realizes, like, with the money they do have laying around in retirement, it's not really meant to go spend it on trying to reverse health issues at this point. He's admitted that his poor decisions over the years have definitely caught up to him, and he's really degenerated and gone off the cliff in the last couple of years. So he's like, does it make sense to give this a whirl? Maybe consider low dosage, find a brand of it that we're all comfortable with, and start to take some of the weight off to get me to feel and function better. I was like, it's really not a bad idea, Bob. Definitely not a bad idea, because honestly, after the weight drops, he could end up getting off one of the 3 blood pressure meds that are absolutely messing with how he can stand upright and just be able to walk. He could end up not having to cycle on and off steroids from aches and pains, all sorts of cool things. And just the fact that a couple of the other meds that he has to deal with based from a Parkinsonism disease that's really knocking him over this cliff here, is affecting aches and pains in his body. So if we can take some weight off, maybe the aches and pains get better. So it's definitely to each his own, obviously, and everyone's got different situations to consider. But when it comes to those GLP-1s, I think it's like a fad like anything else. I know that I was in school 12 years ago, something like that, and we were reading up on articles talking about how the pharmaceutical industry was getting ready to, they were testing, and they were in the middle of bringing out vaccines for obesity. And all of us were like, no way. Like, that's just vaccines for obesity. I mean, first off, vaccines are used for transmissible diseases, not because you're gaining weight and holding on to it. And I wonder if this was it. I wonder if it was GLP-1s that they were testing. And it's not a vaccine, but it's a shot. For most of them, it's a shot that you take to help bring weight down. So I think those 3 topics are a good little stopping point, because the next show we'll go into some anti-aging, and then I'm going to go back to our hippie land, if you will, and I'm going to talk about grounding. Grounding is, and a couple other things along the lines of grounding. Grounding's been coming up a lot, and then even maybe that'll segue a little into talking about EMFs and devices that give off EMFs, like the phone and all that good stuff, and talking about how devices that block EMFs could be something. But these are all topics that are kind of trending, popping up quite a bit in conversation, and people are emailing and writing and asking about. So I hope that was somewhat useful. And next show, again, we're going to be talking about all the other kind of big 3 that are popping up. And we'll see you guys next time.
All right, everyone. The Dr. Alex Show is brought to you by Shed Light Cold Lasers. Shed Light Cold Lasers is, bar none, the biggest thing that has changed our practice at HML. Not only on a professional basis and the results that we are getting with our patients, because for all the professionals out there, everything from veterinarians to medical doctors to everyone in between, you can use this laser in your practice for just about anything. But on a personal basis, because what's unique about this laser is it is handheld. And if you know anything about cold lasers, a lot of times they're big, they're gaudy, you almost have to bolt them to a wall and you can't take them anywhere. This one you can take anywhere. That's because the diodes are LED, so it runs on really good lithium-ion batteries. And the other awesome feature about this, if you know anything about lasers, is that you can kind of see it on camera there. This laser has red light and infrared light. So we won't go into the details there, but just know that you got all of those features. It also comes preloaded with all of the presets to work on specific organ systems, to work on different areas of the brain, like our specialty at HML, as well as a whole host of other things that you can do with this laser. And to learn more about the lasers, head on over to shedlightcoldlasers.com, 518-338-6658, or you can email Dr. Griswold, or Griswold as I call him, shedlightinformation@gmail.com. And we want to note that you don't have to be a doc to buy these. You can be a patient, someone off the street. And Shed Light specializes in educating professionals, doctors, therapists, as well as lay public people, if you will. If they want to buy a laser, they will completely educate you on how to use it, or they will send you to a doc on the ground, someone like us, to learn how to use it, or they'll just send you to that doctor's office and then you can let the doc take over. Either way, they'll give you all the knowledge and information and resources you need to either get that laser or where to find one in the doc's office.